I really think the biggest challenge with immunoconjugate is safety and therapeutic index in general. And it's not really different from what you get with chemotherapy. The toxins we put on antibodies are similar to some of the chemotherapy treatment. They're just too potent to be used alone. So it's really critical that when you build an immunoconjugate, you buy this safety margin that allows you to dose the molecule. So one of the biggest challenge, and we can take different approaches to fix that, whether it's combining toxins so they never end up at the same place at the same time, optimizing target selection, building more robust conjugates through site-specific conjugations, other approaches. But I think a lot of what we're trying to do right now in the field is improving the therapeutic window. So being able to give more ADCs, more immunoconjugates to patients without triggering the onset of side effects. So when I look at technologies that could impact my work, I'm going to make a number of general statements because ADCs are made of different parts. You have a targeting antibody, you have a payload and a linker. And I think there's developments in the biotech and pharma fields that are affecting all those different bits and pieces. For example, I'm really closely tracking the development of bispecifics and multispecific antibodies because I think they have a great chance of improving on the safety profile of antibodies by improving their specificity for the tumor, but also improving the way the ADCs get internalized into cancer cells and shuffling in general. I'm also tracking the emergence of new toxins that would be maybe more potent against indolent tumors that don't divide as actively as the tumors we're targeting right now, and also combinations of toxins. So chemistry developments, linker, a lot of the site-specific conjugation, the way people make ADCs differently as well, and how we will work on multispecificity to develop a new generation of antibodies that relies on more complex but more exquisite targeting mechanisms.